Do you have burning or aching in your lower back? Does it sometimes feel like an electrical pain? Does it feel like a sharp pain in your back or your lower leg that sometimes travels down the leg? Then you may have discogenic low back pain. Thank you for tuning in today to our channel where we aim to give you, the patient, the most up-to-date, evidence-based information. My name is Alexander Jimenez, and today we will be covering how spinal decompression can help treat your discogenic low back pain. So let's start off with our main question. In patients suffering from discogenic low back pain, can non-surgical spinal decompression help alleviate pain? Some of the other topics that we have are: why is spinal decompression important? What is spinal decompression therapy? How does spinal decompression therapy work? What is discogenic low back pain? What is the cause of discogenic low back pain? And what are the types of disc back pain injuries? So let's start off with our first question here. Why is spinal decompression so important? An interesting statistic that we pulled up from the journal articles that I have referenced here is that over 80% of adults experience lumbar pain at least once in their lifetime. It's also interesting to note that 80% of these structures causing lumbar pain are related to intervertebral disc injuries. So spinal decompression is important because it can help alleviate or decrease the pressure on the intervertebral disc that is normally caused by gravity. Spinal decompression is one of the best conservative care treatment modalities used to treat disc lesions and herniations. So I'm sure you've heard of spinal decompression therapy, so let's kind of go over what it is specifically and what it is about this modality that allows us to treat spinal lesions or disc herniation. It's a non-surgical treatment modality used to relieve pain and other symptoms associated with spinal disc injuries such as herniated discs, degenerative disc disease, and spinal stenosis. The primary goal of spinal decompression therapy is to reduce the pressure on the spinal discs. Now there's two variations of this technique for this treatment modality. The first is manual decompression, and the second is mechanical spinal decompression. So let's start with manual spinal decompression. This type of variation is the most used and applied version of spinal decompression. This involves manual manipulation performed by a trained professional such as a chiropractor or physical therapist. The practitioner will use a hands-on technique to apply a gentle traction force to specific segments of the spine on a specifically designed table. The traction forces relieve pressure on the spinal discs and nerves. This process of repeatedly performing this action in intervals is called imbibition. The next type is mechanical spinal decompression. This application of the technique involves the use of a specialized machine, which is often referred to as a spinal decompression machine or a traction table. The patient is positioned supine or face up on the table, and the device applies a controlled traction force on the spine. The traction forces create a negative pressure within the spinal discs, which can help retract herniated discs or bulging disc material. This process also helps bring an influx of vital nutrients and oxygen that is necessary for maintaining proper disc health. So how does spinal decompression work? The whole purpose of the intervertebral disc is to allow for a cushion mechanism between the vertebrae. The IVDs, or intervertebral discs, act as a shock absorber and allow for normal flexible motions of the spine. When pathology or diseases, such as disc herniations, disc degenerative diseases, or spinal stenosis occur, there is a tremendous increase in the pressure on these discs. The caudal and cephalad forces applied, using either the manual or mechanical methods, create negative pressure within the intervertebral discs. This effect is responsible for increasing the hydration of the disc and reducing pressure on the nerve roots. This process of spinal decompression also allows for the relaxation of tightened muscles that are surrounding the injured disc. These muscles are called the paraspinal muscles. So now that we know what spinal decompression is, let's cover discogenic low back pain. Discogenic pain involves degenerative changes that affect the intervertebral discs. These changes are often due to structural deficits that result in altered biomechanical instability and inflammation. The instability and inflammation manifests itself as the common symptoms that are associated with a disc herniation or degenerative disc disease. Common symptoms that are associated with these types of diseases are burning, aching, electrical pain, and sharp back or leg pain that may extend below the knee. So what are the causes of discogenic low back pain? There's two primary reasons for disc herniations to occur. The first is normal degenerative changes due to aging, and the second is trauma. Now, the most common locations are the lumbar spine and cervical spine. These areas are affected the most due to the forces exerted on the flexible portions of the spine, as well as some of the anatomical variants. So I'm going to pull up a slide here and kind of show you the in-depth anatomy of what it is that's kind of going on and why these disc herniations tend to occur for the most part in the lumbar spine. So as you can see here, we have a couple of vertebra. So we have L3, L4, and L5. And I've added some of the cross sections so you can kind of see what's going on here. Here we have the intervertebral disc between L3 and L4. So you can see that here's the outer portion, the fibrous portion called the annulus fibrosus, and then we have the center portion called the nucleus pulposus. What happens with a disc herniation is that this center portion here will tend to protrude outward, and depending on the severity, it can rupture, releasing certain chemokines or cytokines, or put pressure on the dorsal root ganglion, which is this section here, which can cause that pain or that radiation down the leg, depending on where it occurs and the severity of the disc herniation. Now, the main reason that these discs protrude posteriorly versus anteriorly is because of the way that the front side of the spine is designed with the ligamentous structure in compared to the back side of the spine with the ligamentous structures. Let's kind of take a look at those here. So as you can see, on the back side of the spine is the posterior longitudinal ligament. On the front side, you have this huge ligament, which is called the anterior longitudinal ligament. So you can kind of see that when the disc herniates or prolapses, or depending on the severity of the injury, it will go out posterior and laterally and most likely affect the nerves in that direct area. The reason pain is caused by a disc herniation is due to the mechanical forces from compression of the nerve caused by the disc or nucleus pulposus and the local increase in inflammatory chemokines. Now, something that I always found interesting was the words cytokines and chemokines were always thrown around interchangeably in medicine and science, so I wanted to see what the difference was between them. So I found this in the journal article that's referenced here, and I have the links at the end of this PowerPoint presentation. So, cytokines are exceptionally large proteins. They can either be pro or anti-inflammatory in nature and are grouped based on their function and receptor modulation. Chemokines are a group of secreted proteins within the cytokine family whose primary function is to induce cell migration. So it's kind of that flare. Chemokines serve as a flare to cause back pain in order to prevent you from further injuring or causing more damage to the local area. That's that pain that we see that is associated and is commonly found in discogenic low back pain caused by disc herniations or degenerative disc diseases. When a disc herniation occurs, it is most likely to herniate posterolateral due to the way the ligamentous structures are designed on the spine. As we showed you before, the anterior longitudinal ligament is much broader and thicker, preventing from an anterior prolapse or herniation, versus the posterior longitudinal ligament is more likely to suffer a posterolateral disc lesion or herniation. And as you can see, I have a schematic which I really like because it shows all the types of disc herniations. You can kind of see it expanded. So at the top we have a normal disc. Below that, degenerative disc, a bulging disc, a herniated disc. You can see how that red marked inflammatory area can be pushing on the spine, causing you that pain. A thinning disc and a disc degeneration with osteophyte formation. So a disc herniation occurs when the center portion, as we said before, the nucleus pulposus, protrudes through the tough outer layer, the annulus fibrosus. Now there's two main mechanisms of pain generation. The first one, as we said before, is mechanical, and this is when the nucleus pulposus physically pushes on the surrounding nerves or spinal cord, causing the common symptoms of a disc herniation. The chemical inflammation is the other type of pain generation. So the released chemokines from the degenerating discs or traumatic disc injuries promote infiltration of T and B cells, macrophages, neutrophils, and mast cells. The activation of these cells amplifies the inflammation process greatly. The migration of these inflammatory proteins will also cause the appearance of new microvasculature and nerves which arise from the dorsal root ganglion. The structure formation in combination with neurogenic factors generated by the injured disc induce the expression of pain in the cation channels of the dorsal root ganglion. Now here we have a very complex schematic. I won't go into it too in-depthly, but I wanted to show those that were in the medical field kind of what's going on in the inflammation process when a disc degeneration occurs or a herniation occurs. So you can kind of see the cascade as it happens. So we have the increase in chemokines, which is immunocyte activation and migration, kind of coming back into this inflammatory cascade, and ultimately it leads back to the cause of back and radicular pain. These are the pain-like symptoms that we can see in patients as they present in the office. So let's come back to the main question. In patients suffering from discogenic low back pain, does spinal decompression help alleviate pain? So let's go into a few specific studies and articles that show that spinal decompression does alleviate pain. The first article that we have here is a randomized control trial. It took a look at spinal decompression with physical therapy versus physical therapy alone to improve pain. The conclusion was that a combination of non-surgical spinal decompression therapy with routine physical therapy is more effective statistically and clinically than routine physical therapy alone in terms of improving pain. The second article was a study performed to assess if non-surgical spinal decompression therapy could alleviate discogenic back pain. The conclusion was that non-surgical spinal decompression therapy significantly reduced the herniation index, which was calculated based on the follow-up MRI examination. Additionally, patients who received NSDT had improvement in not only pain but their function as well. Now, the third and final article that I'm going to reference here took a look at spinal decompression with trunk stability exercises versus traction therapy with trunk stability exercises. The findings were that the disc herniation index in the decompression group decreased significantly in comparison with that of the traction group, and the difference in the change in disc herniation index between the groups was significant. So now we know that for sure spinal decompression therapy is a great modality to be used on people with discogenic low back pain. So let's cover why go to a chiropractor for spinal decompression therapy. Now, chiropractors are healthcare professionals who specialize in the diagnosis and treatment of musculoskeletal disorders, particularly those related to the spine. Many chiropractors offer spinal decompression therapy as a tool in their toolbox to help treat your specific needs when it comes to back pain, and in this case, discogenic low back pain. Chiropractors are conservative care oriented and will strive to give you the best options to help treat your discogenic low back pain. Now, it's important to remember that in cases without neurological deficits, 60 to 90% of lumbar disc herniations can be treated successfully with spinal decompression alone. That's an important takeaway note there. That's all I have for you guys today, and then we have the sources here at the end. I hope this video was helpful and informative in aiding you and guiding you into the best treatment modalities for discogenic low back pain. If you found this video helpful and informative, please comment, like, share, and subscribe, as it is the best way to support our channels. Thank you and have a wonderful day.